right. Thank you so much, everybody. We are letting Zoom filter people into the room. As usual, it takes way too long and it feels awkward sitting here watching the numbers not go anywhere, but I know there's more students waiting to get in here. But thank you for those of you who are watching this by YouTube after the fact. My name's Dr. Cameron Matthews. I'm a family physician and one of the co-founders of the Tour for Diversity in Medicine that sponsors the Road to Residency program. Along with the Student National Medical Association and the Latino Medical Student Association, we've hosted this program now 5 years in a row, where we coordinate mock interviews for SNMA and LMSA graduating students and do a series of webinars like this one tonight. And in fact, 2 others are running tonight. I think I have peds and ortho running concurrently along with this. And we have more students this year signed up for the program than we have ever had. So I'm so excited that we can bring just a bit of advice and hopefully motivation, hopefully a little bit of direction to help you in this upcoming application season. So I'm going to go around my Brady Bunch squares here and let my friends, colleagues introduce themselves. Dr. Wheat, why don't you jump in first?
Sure. Thank you for having me. I am Dr. Santina or Tina Wheat. I am a program director at Northwestern Del Nor, which is located in Geneva, Illinois, but I myself am sitting in Chicago, Illinois right now, and I'm happy to be here.
Great. Dr. Smyre.
Hi, everyone. My name is Dr. Christopher Smyre. I'm at Southern Illinois University School of Medicine in Springfield, Illinois, and I am the Associate Chair of Diversity, Equity, Inclusion for our Family Medicine Department, and happy to be here.
Fabulous. Dr. Lee.
Hello, I'm Dr. Marshala Lee. I am a family medicine physician at Christiana Care in Wilmington, Delaware. I'm the director of the Harrington Trust, which supports health equity and health workforce diversity programming. I'm also a faculty member for Jefferson Medical School.
Okay. And Dr. Walker.
Hi, I'm Dr. Walker. I'm a family medicine physician at a community health center in Massachusetts. I'm also faculty at Tufts Medical School, and I'm the executive director of the Association of Black Family Medicine Physicians, and we support residents and medical students that are pursuing a career in family medicine.
I love it. Talk about big players. I'm so excited. All right. So for my attendees that are with us live, I think I turned on the chat for everybody. I would love, as we're about to jump into the next question, if everyone on here could get a little bit interactive, drop where you are, what year you are. It'd be helpful for us to just get an understanding of who's with us in the crowd. So please get on your keyboards or whatever, and give us a little bit of information about yourselves. So I would love to jump in while the students are being interactive. I'm going to keep plugging you. I would love to hear from each of you, because we're focusing on the residency application and we all love family medicine. So that's going to come out at some point why we chose it. But yeah, I'm trying not to jump into that right away. But what was your biggest, I'm going to ask your biggest worry about applying to residency? Like thinking back, what was your biggest question? What concerned you? What were you nervous about? Because I have a feeling, hopefully some of our students in the audience might have the same concern. So I want to just level set that this is can be somewhat of a nerve-wracking process. What were your biggest concerns? Do you remember? Anybody jump in?
I feel old and like this was a really long time ago, but I was always nervous about 2 things. One, that I was going to get lost in the crowd, that my application wouldn't stand out, and so then I wouldn't get an interview. And that I was nervous about asking the questions that I really wanted to ask. Like I really cared about having a family and had older parents, and so I was worried about how could I ask those things in the program. What somebody told me that I thought was really wise about that second one, though, was if I was applying to a program that I wasn't able to ask those questions, then maybe that wasn't for me anyhow. And so that was the thing that hit on me the most, is the stuff outside of medicine is the hardest part of residency. Like, how does that rest of that keep going?
It's a great point. Great point. Anybody else? What were your fears, your reservations?
think for me, my big reservation was getting past that screening to get the interview because I felt once I got the interview, I could sell myself. But then the other part was how do I make sure that I am choosing the right fit as far as long-term interest? I knew I always want to do academic medicine, and so getting the skills beyond just the clinical training for research scholarship was a big concern of will there be mentorship? Will there be people who can advise and support my development into staying in academia?
And I was most concerned about diversity after going to medical school where there wasn't much diversity. I was a bit tired of being the oddball or felt like eyes were on me. So I wanted to go somewhere where I felt more like I wasn't the oddball in the room and wanted faculty that was aware of my differences and were able to support and my differences as well.
I love that.
Yeah. For me, I also was very, oh, am I gonna match? And so I honestly over applied past what my advisors did. And I was like, they were right. So listen to your advisor's first recommendation. Um, Secondly, for me, I loved everything about family medicine. And so I was like, I want to do it all. And, I want to, have the whole, experience. And so it's like, but how do I fit it all in? And how do I find a program that is doing it all? So that was one of my biggest things of like, I want to do inpatient, outpatient, and just to have the options to then decide what I might not want to do in the future, because every program is different. They have a saying like, you see one program, you saw one program. All the programs are not the same. So really kind of being able to hone in on what it was that I actually wanted or didn't want. And so going through that process, I kind of took away like, what is it that I can learn during residency that I feel like is really important for me to get during residency versus being able to expand upon after residency, because your learning never stops.
Yeah. I love all of this because I definitely shared every single point that you guys said. I think for me, I was, Chris, what you said jumped out. Like, am I going to even get to the interview? Because I feel like I can have a conversation. I mean, we're family docs. We know how to communicate, right? Like that comes as part of our blood, right? But like, was I going to be impressive enough just on the application, right? So did I say the right things in the personal statement? Were my, rotation evaluation strong enough? Was my dean's letter strong enough? Because I didn't know how to think about any of that. Especially because I was a kind of non-traditional student. And so we all got our spots. So there we go. So these worries are completely natural. So I guess the question is, particularly for those of you that were nervous about like your selection choices, right? Is it going to support me from a diversity standpoint? Can I really ask the right questions? Am I going to learn what I really need to learn to do what I want to do in my career? How did you figure that out? Like at what point in the application process were you gathering that information and that you felt you had, enough of that data to then rank your programs appropriately? I mean, were websites enough, or how did you get the information?
So I use a combination of things. There's some stuff in deciding, am I even going to apply here? So I looked at the residents that graduated, what are they doing now? Because if the alumni of that program are in a certain place that I want to be at, then it's easier for me to just go with the flow of that program to get there. But if what I'm wanting is no one's done that, then you're probably going to be working against the current. And I actually had someone tell me after my interview, was like, you like to do a lot of, why is this button we pushing in? You come from University of Chicago and I used to be faculty there. We don't really focus on the big why. We focus more on just clinical skill building. And so I think for me, looking at where people are now from the program gives me a good idea, as well as how much time are you devoted in different rotations. Where I trained at Northwestern's Humboldt Park program, you did 2 months of OB every year. That wasn't just because you chose to love OB, it's just standard. And so that time then means most of us afterwards are still practicing OB, like myself. And so where your time is really where your skills and knowledge is going to grow and be developed in. So those are the things that I did pre. And then during the interview, I look at it as like, as much as I'm being interviewed, I'm also interviewing them because I have to rank and I have a choice here. And so making sure and finding faculty who look like me, asking questions about what their plans are as far as diversity, are they making intentional efforts? Is that something that's an active consideration in sort of the culture that they're building or things and based off of their responses? If someone we thinking about it, we made some strides, we tried something, we just haven't seen the retention yet. I rank that higher than if someone was surprised, you could tell they were just making something up on the fly, is that wasn't something they had been considering and thinking about as an important thing that applicant would consider. And so those were really the big things that helped me to then decide how to rank my final rank list.
I love that. And let me kind of repeat it back the way I'm kind of hearing that second part, asking questions during the interview and throughout the interview day, to me is kind of the subjective, right? Like you're getting feedback, you really want to hear what answers they're sharing and everything. But then you also looked objectively. What are their graduates doing? How are they actually spending time? Where are they sending the residents and everything? So you're gathering data from different pieces throughout your interaction with the program, which is important because you need to see it end to end like that. So that's great. That's great. How did you choose your particular programs? Did anything like jump out as scary about another program that forced you to rank your number one? Like what was it that really sold you for number one? And I know it's going to be very individualized factors, so please don't generalize. Speak quite personal.
I was actually terrified.
Yeah.
I wasn't having the best experience on some of my interviews. I felt like they were really quizzing me. I even had one interview where there was a quiz, and I was like, "Hold up,
What do you
do you
mean?
even want?" Like there was a medical quiz during the interview, like a clinical scenario or something that.
Oh, Lord.
And I'm like, oh, this is not the type of feeling that I want when I'm training at this program. And so, in addition to the lack of diversity, and just felt like I would always be on edge. And so, people said, you will know when the program is for you. And unfortunately, it wasn't until my last interview that I knew, and that was the program that I ended up selecting. But it was the program where I felt comfortable talking to the interviewees. I felt comfortable with the patient population. That made a difference. And so it was the interview that I felt like I wasn't actually being interviewed, but that I was talking among my colleagues.
I love it. Yeah, like actual conversation, not being drilled. Yeah, I think that's an important part, right? Because we say this, but not everybody actually lives it, that it's supposed to be bi-directional. You're interviewing each other. And so them kind of putting you on the spot with some cases and everything, that kind of negates that, doesn't it? Ugh, yeah, I think that would turn me off too.
If I could sort of jump in like with my program director hat and not as a as an applicant, if you don't mind.
Of course.
I would say that take this time now, not just to look at the websites and ask us questions. Like I will always answer a question if you send it to me and you're interested in my program. If I'm not the right person to answer it, I will send it to somebody else. But now is the time where you have the opportunity to ask us a lot of questions and we won't get in trouble for responding to you. There's none of the match violation stuff that is happening yet. And so I would encourage you to not just go based on the website. I would ask you to ask more questions. I would also encourage you, though, to not ask a question that you can directly see on the website, because that makes me, as a program, be like, you didn't actually look into anything before you reached out to me.
Yep.
And try to look at those things and get some of those questions so that you don't waste your time. Like, don't waste your money applying to a program that you can look at it and be like, I'm never going to go there. And so back to the original question, like my thing was I didn't want to go someplace that wasn't going to let me do contraception. Reproductive health was really important to me. And that was a big thing in Illinois at the time. There was lots of takeovers happening with religious institutions. And so there were programs that I just did not apply to because I knew I wasn't going to be able to learn things in the way that I wanted to. So that was a specific, I wouldn't apply to those programs because of that.
I love it. Ryan, what about you? How'd you choose your program? Where did you train? Actually, no, I think
I
about it.
trained at Lawrence, which was actually a 4-year program, which I did not do on purpose in regards to like saying I was going to go to a 4-year program. But I do want to mention that it's a option and that, you know, all 4-year programs are not the same, but maybe something to look into. But for me, I was familiar with Lawrence already because I was at Tufts and it's a Tufts affiliated program. So for me, I was actually trying to run away from it because I was like, I don't want to be biased. And I just like am going here because I know people and I know the program like more personally. And but for me, one thing that was really important because I did a dual degree, MD and PH, and I was like, I really want to be able to merge both my interest in family medicine and public health and like what does community engagement really look like and not just serving different populations. And so I think for me, when I was interviewing and asking specifically, like, what type of like community engagement are you all doing? And also asking people the same question at the same program and seeing if there was a consistency. It was really interesting
Look at
because
you.
I interviewed at a very like academic institution and I thought, you know, I was going to get this answer and I was like, oh, you guys don't know what community engagement is or our like definition of community engagement is not in alignment. And I tried to ask the same question to the same person, a different person at the program. And I said, except for these things, and they gave me the same answer. And I was like, no, okay, X off. And so for me, being able to be at an institution where I had a little bit more flexibility in my training, to kind of pick and choose and also to expand on certain things. So at Lawrence specifically, we have like basically a built-in fellowship. But part of that's because we have the time and that's the way the program is kind of built in. But also they do a lot of high risk because we are kind of like we're outside of Boston, but it's a patient population where they don't like going to Boston, but also very marginalized. And I felt that they really spoke to serving the patients where they were, and they put their money where their mouth was. So one of the things about Lawrence is that it's a very Spanish speaking predominant population, and they actually taught, they were like basically you learn to speak Spanish, like that's just it. Like they sent us to Dartmouth, they had a tutor, they sent us to another country to learn Spanish, do Spanish school. I was like, oh, okay, you're really supporting us to learn Spanish. It's like really important that we be able to communicate with our patients. Got it. And so that was a skill that I was already trying to build on, but it was like I would, you know, interview at other places and they were just like, oh yeah, like some people just, you know, learn, but it wasn't like
I was
hard.
going to say that's a huge sign of their commitment,
Yeah,
not just to you and your ability to speak Spanish, but more importantly to the patients
correct.
that they wanted you to be as ready and knowledgeable about how to help them. That's huge.
Yeah.
I love that. I love that. Um, Tina, real quick, there's a question that I think fits well with your point that you were making about, you know, asking questions now. Now's the time to be able to do that without violating any of the rules. What's the best way to reach out? Do you just recommend they email you as a program director? Should they reach out to current residents? Maybe both, all the above.
I think it depends on what your question is. Like, if you want to know, does your application meet my criteria, then reach out to me because I don't want anybody else giving you a wrong answer for that. And I'm going to be straight with you. If you want to know what resident life is, I'm going to tell you what I think resident life is, but you want to talk to a resident. And so you can reach out to me and I will send you to them. But you want the real answer because truthfully, I don't want someone to come to the program that's not going to be happy. That's miserable for you and that's miserable for me. And so I really want it to be the right fit. So I would say all of the above is okay, but you can start with whatever the communication is on the website. Like I can say for my program and my previous program, it was like a generic that got sent to both the coordinator and the program director. And so then we would disperse it to whoever the correct person to respond was.
Oh, perfect. Perfect. So we're all faculty in some way, whether teaching students and or residents and the like. when you guys are reviewing applications, um, what stands out for you in an application? What's something where you're like, okay, I'm interested, I want to learn more, right? To get us to through the screening to the interview process. What stands out for you in the application? And then let's talk about what stands out during the interview, because I think there's kind of different buckets there.
So I can start. For
Please.
me, with the application, there's some generic stuff that's just part of the culture of family medicine. And so when I read it, I want to be like, oh yeah, this is my people. They seem like they're a part of my tribe. Their focus seems to align with things that I think are important, should be the focus and priority. And within that, I want to hear mostly about your uniqueness because you are an N of one. And so while everyone may, or not everyone, most people may have had loved ones that were sick that you wanted to then be the bridge to help with communication, how you frame and tell your specific experience with your family and what that means to you gives me insight to you. And so when you get those more specific details, it's like, oh, I never heard that take on it, or this seems like someone who's really thought this all the way through and has a clear vision of the power and impact you can have as a family medicine provider where you're knowledgeable in a lot of areas to help with bridging, advocating, supporting, and navigating. Those are the things that are going to stand out to me, but that's really just you being your authentic self on paper.
I love that.
Along those lines, I'm looking for someone who has a strong commitment to family medicine. Sometimes people unfortunately choose family medicine as a second or third thought. And so I look for people who, since freshman year, sophomore year, participated in the family medicine interest group, have done some volunteer community service, even if it wasn't family medicine, primary care, interest groups, and are able to document that throughout their application, that they understand what family medicine is and that they have shown some commitment prior to applying.
Love it. So with that though, Dr. Lee, if someone maybe decided family medicine a little bit later, right, but hadn't been involved maybe with like a peds interest group or done some research on derm or something, like, is that a big ding when you see that in the application?
It's not a ding, but again, they would need to, in their personal statement, probably provide a little bit more information about how they experience or other experiences that they've had since those experiences that have drawn them towards family medicine. So no, we definitely want people who are well-rounded because family medicine encompasses peds, derm, all of the above, but we still want someone who's interested in all those different areas because nothing's worse than someone interviewing and they're being like, do I actually have to take care of kids? Do I have to do that rotation? Yes, family medicine, you still have to see pediatric patients. So we want someone who is well-rounded and is looking for that type of training.
Perfect. Perfect. Um,
Before you move on, can I also just
yeah.
say one of the things that I saw last year that was a miss for a lot of people was that there's new places in the application where there's ways to throw your authentic self in there. Don't ignore any of those. Like if you are putting something in as a geographic preference, like tell me why, throw your authentic self into that. There is a place that talks about like a meaningful experience. And I would say half of the people whose applications I read chose not to answer that. And I don't know if it was because they received bad advice, but those are places where you can absolutely stand out because, and to be honest, I go to those places first because it allows me to find folks that have developed emotional intelligence and resilience, which are two of the things I think are most important for residency. And so just don't leave an opportunity on the table.
There we go. I love that. Perfect. So, oh my gosh, emotional intelligence and resilience. I couldn't summarize that as succinctly in any better way. But what makes a good applicant to family medicine? not what makes them stand out, but like what are the strengths that you're actually looking for, maybe across all applications, right? Emotional intelligence and resilience, I think, are top, definitely. But are there other pieces that you're specifically looking for, like this has to be there, or maybe you're questioning a little bit about whether they're the right fit?
Um, do you, I mean, in education speak, do you have a growth mindset? And so can you demonstrate to me how you have learned from your mistakes and how you're going to move forward? Because my job over the next 3 years or 4 years, depending on what type of program you choose, is to teach you to be the best doctor that you can be to take care of the patients in front of you, and also be the best person that you can be, because this is a profession which sort of bleeds into who you are. And that's hard. So you're gonna get some real feedback. You're gonna get some real tough days, and you're gonna get that stuff when you are tired. Like you get that when you're hangry and don't sleep. And so are you open to this process? So those three things are my, like, if somebody asks me, what are you looking for in a resident? Those are the three things that I care about. And then that you care about my community if you're applying to my program. And so you can care about different communities, but if you're applying to my program, I want you to care about my community.
Beautiful. Beautiful. What about the standards? What about, step scores and letter of recommendation or references and things like that? Do we put a lot of weight behind those as well?
Unfortunately, there's so many applicants that apply now that those are metrics that weight still has to be applied towards. It's not the end all be all, but we recommend that we see growth and upward trajectory from people. So even if you didn't do well on step one, what did you learn from that? Hopefully you did much better on step two. But if not, hopefully the applicant has a lot more community service or other experiences that you can validate or state in your application and justify. So yes, those metrics, because we do have to have things that we use to screen applicants. But even with those screening metrics, there are other applicants that still stick out and we think are deserving for interviews.
Love it.
And can I add something to that too?
Please, of course.
Another part of this too, with like scoring and passing your step exams, we also want to make sure that we can support and everyone we bring in, we can get through, right? And so one of the things that we think about, we actually just had a conversation at our institution today on our policy reviewing it, is the number of attempts you have from step one start to when you take step three, the number of years you have, and looking at that and saying, hey, if someone is a poor test taker, but they're awesome, they have great skills, we know that your test performance is not related or predictive in any way of your actual clinical skills and engagement. But if we don't have funding that we can support multiple people with test prep material and things like that, we can't bring in multiple people who may struggle with testing. And so part of it is also looking at the resources that we have as we build a full class. Can we support all of them? Because some people may be good test takers, but may not have some of those emotional intelligence and other resilient skills built up.
Mhm.
Well, we need to make sure we have therapy support other services for that individual where they may struggle in their development. And so building a class where we can support everyone with where their growth opportunities may be is something that goes into that consideration, so that we're not bringing someone in, but then we can't actually support them and get them the proper support to pass or to thrive during our time, is also a part of that conversation when looking at your test taking and scoring, things like that.
Mhm. So you have to have some capacity for obviously medical knowledge, for learning, for growth. So not necessarily coming in perfect, but you're moldable, and that you're going to be successful. Um, how does a student show all of this, guys? Like, how do you judge whether somebody is emotionally intelligent or that they have a growth mindset? Or is it just in the interview? Is there some way that students can even speak to those things in the personal statement, for instance?
So like I said before, don't take don't leave anything on the table. So if there is something that you need to explain, I had somebody that was given advice last year to wait until they got to the interview, but who knew if they were going to get chosen or not? And like they reached out to me and I was like, I can't respond to this person because there's all of these challenges within their application. So use your personal statement, use your experiences to say what happened, and please don't blame it on the testing. Please don't blame it on whatever else. Please take some ownership within that if that was a thing, or if you had testing is just one example. If you had a bad experience with a patient, for example, what I'm looking for is not the person that says, oh, they were just wrong, and so I told them that they were wrong. Even if they were wrong, I want you to tell me, what did you learn from yourself about how you could approach that situation differently? How can you communicate with different people? Because you're going to run into a lot of people with family medicine that have different views than you. And so you need to be able to pivot and adjust in that communication. And so I want to see that both in your essays and then also, like in my program, I'm always the person that asks about challenges. I want you to answer that honestly and authentically to me in the interview too.
I love that. Leave nothing on the table. Thank you. Use every opportunity and think of your application end to end. Exactly. There's no assumption that you're going to have the interview, that it's going to go well, that you're going to have that one person where you're going to be able to put everything out on the table. So use every opportunity to share information and to be able to describe yourself fully and at your best. I love that. Chris.
Yeah. And also think about your letters of recommendations. So there may be spaces where your letters of recommendation can talk about your skills, the way that you engage. They can talk about how you navigate situations, and sort of that's part of your portfolio. And so you really want to think about, where do I want these messages, like Dr. Wee was saying, to be put out there? Some of those you can do with your meaningful experiences, your personal statement. And some you may say, hey, can you write me a strong letter? And could you really emphasize this piece? And that may be where you let that sort of come across as you're trying to communicate all different aspects of yourself and your strengths.
I love it. Another new section now, the second year in a row, we have this concept of impactful experiences, where I mean, actually, it's up to the student to define impactful, right? And to be able to describe that. Do you recommend any distinction between what goes in impactful experiences versus personal statement? I usually do, but I don't know what experiences you guys have had with that. Marshall, go ahead. I see you.
I don't make a major distinction between those areas, but
Yeah, I mean, it's all data, right? It's all information in the application. So whether you mention it in one place or the other, usually we don't want them to duplicate though, right? It makes absolutely no sense to describe something as impactful and then use a whole paragraph in your personal statement over there to do the same. So it's not this linear sort of process. We're considering your application holistically, not just who you are as a person, but every part of the application. So definitely use your impactful experiences to share some information in your personal statement to as another space to speak about something else. That's
I
great.
want to echo what you said, because sometimes I've seen people write personal statements and it's just like literally listing, I've done this. Don't repeat your CV. Especially within family medicine, personal statement can really be a story, to highlight your skills, to highlight things that you learn, to highlight why family medicine speaks to you, but also it's a way to also highlight what you're looking for in a program so that a program can see themselves in your story as well. So I think it's a little bit artistic, but thinking outside the box is not the same with like, I want to go into family medicine because of this. And these are the things that I've done, and this is why I should be there. Really take this as an opportunity to reflect on who you are as a person, the doctor that you want to be, the type of trainee that you're going to be. Because right now you're really interviewing to be a trainee. And so that means like, how are you going to be able to be moldable and develop into that doctor that you'll eventually get to? So I just want to echo that.
I love that. I love that. All right, I'm going to switch directions. Students, please continue to use the Q&A and drop any other questions about the application in here. But I have four amazing people with amazing backgrounds. So I'm going to let them highlight a little bit more about what they do, how they've used, family medicine to basically be an expression of themselves, of their practice, how they've helped their communities. That's why I love family medicine, because we totally are able to do this as a part of our practice, right? It's expected almost. So Dr. Wheat, I have loved your entire career, but tell us a little bit about like what you've done and how you wound up where you are.
So I was very lucky to meet Dr. Matthews when I was a third year medical student, just sort of popping through, and got to hear her advice on how she flipped everything with her rank list. That really gave me a way to look at this.
Yeah.
Similar to, I think it was Dr. Walker, I also did a joint MD and PH. And so I walked into family medicine with a desire to make my community's health better. Like, I really care about population health, and um, I care about research within family medicine, which not every family doctor will tell you. But I think of it a little bit differently than some other people do. So I do a lot of research that is focused on access, um, on biases, and on education. So those are the three places that you will really find me publishing. And then a lot of my work has been in changing the access in my clinic. So I was formerly at the same program that Dr. Smyre trained in, and I was the medical director first there, and then the program director there. But I was also the medical director of our HIV program. And so I actually had this experience where, like, I changed my scope. Like, I started doing HIV care right out of residency, but I also learned how to do hepatitis C care. I expanded all of the PrEP care throughout our 13 clinics, and really changed what I did based on what our organization needed, and also delivered babies at the same time. And then just recently, I have changed sort of my way at looking at things. I'm a little bit older. My body doesn't really want to deliver babies anymore. And I am helping a different community. So I am helping another program sort of grow and really leaning into the academic part. So helping people get to be the best doctors they can be is like where my true heart and passion is. And so that's why I'm here.
I love it. I love that you've done all of this. I love it. Dr. Lee, you have done so much. You have built so much, including scholarship programs. You've worked at multiple different levels of health systems and the like. Please tell us your path.
My path is very erratic. Born
Good.
and raised in Mississippi, actually thought I was going to be a lawyer, but fell in love with health policy, public health. And my first job in high school was working in a hospital. So that's where I saw that there was a way that I could merge my love for policy and health into a future career. And so I went into medicine knowing that I wanted to work more in the community medicine health policy space, which is unique for most docs. And so I went to Brown Medical School, and they have what is called a advocacy concentration. So during medical school on Wednesdays, not only was I learning how to be a great doctor, but they were teaching me how to write op-eds, how to interact with legislators, how to interact with your community. And so I felt very confident with being a community advocate and engaging with elected officials after leaving medical school. And so I wanted to be the best family doctor, well-rounded. I knew that to go into policy, I need to have a broad array of knowledge. And family medicine was the discipline that would expose me to the most different medical conditions, chronic diseases that the majority of the population face. And I had a special passion for HIV/AIDS. And I actually thought I was going to be an ID doctor at one point, but I converted because during medical school at the time, the medical regimens, a tripla, everything was so much better for patients that were living with HIV/AIDS, that they told me that if you want to focus on HIV, you need to be good at chronic disease management. And so that's what brought me to Baltimore for family medicine, because unfortunately, Baltimore being the city that it is, has a very high predominance of HIV/AIDS, and family doctors in my program felt comfortable caring for their own patients. Not only did they have a strong HIV program, but they also had a strong community medicine focus. And during residency, I was able to create my own childhood obesity program. called Better My Identity, where we focus on the weekends with our students that were at risk for obesity, teaching them about healthy lifestyle, healthy eating. They also had other programs in the community for moms, teaching them about healthy lifestyle and how to breastfeed. And so really, I learned how to be a great community medicine physician with a strong focus on chronic disease management. After that, I obtained my master's in public health from Harvard with the focus in minority health policy. Again, I kept that interest that I had from high school in my hat. And so just continue to build skills across the path. Residency was what was most close to me after finishing residency, and I saw that there was so much that needed to be fixed in family medicine as far as access to patients. And so I actually decided to work for the federal government after completing my master's in public health. And I focused on residency GME for a period of time, really wanting to increase diversity, access, as well as improve some of the training that residents have in community medicine. And so I really love that my time in the federal government, but I miss patient care. And so currently in my current role, I am a family medicine doctor at a local elementary school at a school-based health center. Again, that's that pediatrics that I had in the back of my pocket for a long time ago as well. But I run a trust that supports health equity research as well as workforce diversity programs with a focus on increasing the representation of underrepresented students in medicine. So we have an MCAT prep program. I actually did not take the MCAT. There was a pipeline program for Brown in my undergraduate in Mississippi. So I'm very passionate about minimizing barriers to students pursuing medical careers. And so that's a part of what I do, but my path, I'm continuously saying, what do I want to do next? And family medicine gives me that ability.
Yes, drop the mic. Yes, that's I love it. Oh my gosh, Marshall, you are amazing, and thank you so much for the work you do. And truly, we have to get. I always share when you're posting about your MCAT program. I'm like, oh my gosh, we need more and more students to know about this because this is huge. Because that's a huge barrier, right, for a lot of our students. So thank you for doing that. Dr. Walker, you have founded an organization, you're working in community medicine, you are just doing so much supporting our community as well too. Please tell us what you've done, your path.
Yeah, so I would say that I'm an earlier attendee. I graduated from residency in 2022, so I'm still developing.
Yeah, you are
But
developing. We all are. Don't you worry.
but interesting enough, like Dr. Lee, I started my work prior to med school doing reproductive health work, HIV, and sexual health education in the community. And so something for me that's been really central is community. And so for me, I work at a community health center. I am at my core a teacher and educator. And so that's the way that I approach my practice in ensuring that my patients know about their bodies and they don't walk out with questions and question marks. And so being able to facilitate that rapport with them is really important to bring that authentic space into our practice. And so in that, I do primary care. I take care of newborns, pregnant women, outpatient. I do not do inpatient because that was not my calling. But I do also work on a special team that takes care of moms that have substance use disorders. And so that is a special population. And I've always wanted to practice with, I've believed in practicing it in the community and not just always expecting the community to come to us within centers, health centers, and things of that nature. And so I also work in our outreach team in which we have a clinic that's actually set up in a soup kitchen, and there's a shelter in the same building. And then we also do visits to people's homes as well. And then as part of that outreach team, we have a respite unit that I also work on in which we care for people that are unsheltered but have medical concerns. So we help kind of coordinate their care as a team, working with case management, things of that nature. So I'm kind of moving around clinically in 3 different clinical settings. But outside of that, I'm also faculty in a medical school, and I am the population health content director for our one of the courses that goes throughout all 4 years. And so really bringing that public health perspective and the perspective of patients to medicine, and being reflective of the perspective, it's actually called Perspectives in Medicine, but being reflective of um, the perspectives that we have as clinicians and how that then merges with providing care within systems and for patients. And then the other aspect is I am a first generation college graduate. And my first teachers were actually my grandmother and my great grandmother. And so I've always been very passionate about mentorship, education, helping people come up through the pathways to get through and in this field. And so I just kind of found myself, honestly, as a resident, helping these group of Black medical students who were like, hey, we're going to collaborate together so we can support each other to apply to family residency. And so as a resident, I was invited to one of their Q&As, and I was like, hey, like if you guys need any help, like let me know. And we started this residency application series. And then this medical student just really had this vision. She's like, I want to create an association. I was like, I'll support you any way you want to. And so I started out as a board member of the Association of Black Family Medicine Physicians. And so we are very grassroots, nonprofit, and we are still growing. And so I eventually became the executive director. And so I've been really growing in that role of creating partnerships and how do we, also, expand, but within capacity and all of those things. And so that's been really helpful as I've been able to engage with but medical students and residents across the country and really get a different perspective of other people's experience, but also internationally. We have a lot of IMG students also that are engaged with us. And it's been really exciting. We're really about filling in the gaps, but not replicating things. And how do we centralize information, but also talking about things straight on and not having to, beat around the bush or feel like we have to censor ourselves and being authentic in that space and how we all kind of move forward within family medicine and being doctors. So
Love it. I'm so
check
proud
out
of
the
the work you've
Association
done.
of Thank you. And Tufts University and Dr. Matthews has been a big supporter for us. So check out the
Oh,
Association of Black Family Medicine Physicians.
exactly. Exactly. I mean, you guys go, it's not just a grassroots small thing. You guys are partnering and hosting events at, AAFP sort of conferences and major stuff. So I'm glad that you guys are growing and you've gotten attention and yes, I am in full support whenever you need me. Last but not least, Dr. Smyre, you have, I mean, just even the way we opened before we started the webinar, what you are doing locally within your program and stuff that you've built is so impressive. Please share your path as well too. And I love that I've known you like I've known Tina for years. I love it.
Yeah, so Dr. Matthews, I met when I was pre-med, and she was the SMA former
I gotta bring
president.
my mentees along.
And that really has been my journey of having mentorship and people that have paved the way so that I'm not always having to go down the path untrodden, so you say. Part of my interest when I was in med school, I also got a master's in theological ethics from Divinity School and really looking at sort of how do we merge and bridge religion, spirituality within the medical context, because oftentimes our patients, that's a big core part of their identity. For them not to be able to bring that into the space limits my ability to truly be informed and make informed care that's aligned with their values if we can't talk about that. And so knowing I wanted to stay in academic medicine, went to Northwestern and then at SIU, where I've been able to really grow and have a supportive leadership. Our dean prior to George Floyd murder said that we would become an anti-racist institution, really committed funding to making that happen and really transforming our culture. Our associate dean, Dr. Wendy Elamine, has been another longstanding mentor and family medicine physician who had a lot of great programs and sort of helped for me to be able to get up to where I'm going in my chair. Dr. Albert has been very supportive. So I'll give a plug to all of you if you're looking to go somewhere for residency where you are supported, where there's infrastructure in place, look at SIU School of Medicine in Springfield. But in those roles, I've been able to grow. I'm also doing research. A lot of my research has been around looking at the environment, around psychological safety. How are we developing leaders and sort of avoiding pseudo leadership development where people are sort of being promoted prematurely without the proper support they need because of their identities and things like that. And really in our program, in our institution, we really are looking at sort of if we don't have a space where people feel safe to share in the challenge, then the best ideas aren't being generated. The best solutions for ourselves, for our communities, for our patients aren't being brought to the table for consideration. And so really facilitating those conversations and sort of demonstrating the growth that comes from a diverse, inclusive environment is sort of how I've been able to move into leadership roles and now serve as the associate chair for diversity, equity, inclusion. And one of the things that we really are now looking to do is really engage more with our community to make sure that their needs are being able to be engaged, validated, heard, and seen. And so in Illinois, there was a bill that was passed that required implicit bias training for all healthcare professionals. And my mentor, Dr. Elamy, actually went to Congress and sort of spoke before them in getting that bill passed. And so being able to see how the voice, the credibility as a physician carries within the community, both within our local communities, but also within our political community spaces, is something that I am now exploring more of how do we engage, how do we leverage that voice to better validate the concerns of our patients and sort of to give that credibility. And I think that's something that also applies to our learners because as a resident, you see and experience things in a certain way. And then as faculty, you see and experience things in a different way. And both are important if we're really looking holistic to make sure that we are sort of at the forefront of medicine. And I think those opportunities are the things that I've really enjoyed. And if you come to SIU, Springfield, you can participate and enjoy those things too.
Mic drop. Yes, I love it. I love it. Oh my gosh, all of you are amazing. All of you have clearly built passion into your careers, your work. You have mission focus in all that you do. This isn't just a job. This isn't just a paycheck. You guys have gone above and beyond in each of your roles. And I think that's part and parcel to what family medicine not only allows you to do, but is the appropriate place for you to even continue to grow in that, right? Because we don't stop growing just because we finish residency. And all of you even describe a growth path as you, examine more about yourself and you learn more. You have all matured, not just matured, but expanded your horizon, as corny as that saying is, like above and beyond where you were as a resident, right? And family medicine is the best place to do this, where it's not just about the clinical work, but it's so much bigger. So that's why I wanted to walk through all that you guys do, because I just think it's amazing. And I think it's the reason why you students should be choosing family medicine. I don't know. I think family medicine is the right place to do this. Maybe other fields do that, but I don't think they do it as well, nor with the same passion. For myself, just the last couple of seconds, just to share my path. Um, Family medicine was always this decision, which is why I love that I can connect with students over the years and see them like Tina and Chris get to where they are. Um, just because I believe in the field so much. But for me, I've jumped around a bit, and actually, Marshall, a little bit like you, but like appropriate jumping around. It's not bad jumping around. It's that exploration. So I initially started in correctional medicine, which I personally think all students should have some sort of exposure to. Of course, in Chicago, where we all were, is a little bit easier because it's right there and it wasn't that far to the west side. Might not be as easy in other spaces, but I think it's an unbelievable place to understand the dignity that you have to treat people, that they are patients first and foremost, regardless of their background, regardless of their title as an inmate, and that they have a lot of other drivers of health that are impacting them that are clearly first and foremost. Like if you're going to sit there and push kind of chronic disease management, but they have no idea whether they're going to see their children, their family again, because they don't know when they're actually going to get out of there. That's a whole different set of priorities you need to work through. And I loved engaging with my patients there about that. Then I went to a couple of community health centers, like actually all of us have been in, and at one point, I think most of us, as much as we appreciate academia, whether it's research, policy, teaching, and the like, we still want to be community-based, and that's what community health centers afford us. I personally don't think students, we give you enough of that exposure, and I'm constantly driving that medical schools need to do that, but every single one of us have made that a part of our careers, and that I think is what brings us joy, point blank. We wouldn't be enjoying what we do as much if we were stuck in that kind of academic ivory tower. Um, from there, I went to Veterans Health Administration, and I definitely want to put a plug out there for either the VA or any of the armed services. I think that's a huge area of focus, again, that does not receive attention in medical student training, or for that matter, not really possible as much in residency unless you actually go to one of their residencies. But I think taking care of service members, retirees, and veterans is a critical piece of taking care of a community, and understanding that from an equity standpoint, when we talk about cultural humility and understanding the patient populations they're serving, this is a specialized patient population that is underserved, point blank. Understanding military language and experience, understanding what veterans have gone through, not just kind of military experiences, but just their entire life, even post-separation. That is a different level of acknowledgement of a patient population that we don't get enough training in, point blank. Like by the time I started the VA, I was still like, what are the different services in the arms? I had no idea. Like we don't learn that type stuff. And I loved helping lead the VA. I served as chief medical officer of the entire health system in my last role there. And so understanding just the strength of that health system and understanding what we mean by integrated care. And that's really where my role is now. As much as we brag about family medicine and we say we're the best and we say come train with us, I actually believe that we need to be in a health system where we start to bring down these walls of specialties. I think specialties are really just the way we organize ourselves as docs. It's not how patients think about healthcare, nor is it actually appropriate for them to access care in such a siloed way, because all we do is refer back and forth between specialties. What if there was just a one-stop shop where you could access everything? That's the type of practice I work with now. It's called City Block Health, and we purposefully build everything into a single care team. I don't have different departments of specialties and everything. Our care teams are fully integrated and fully interdisciplinary so that we can jointly take care of patients. And I started learning that at the VA, thinking of a single system where everything's available, maybe like a Kaiser and some other big health systems, but doing so with a bit of a more of a mission. The VA definitely does that, and City Block we do as well. So my path has taken me through a whole bunch of different practice environments with different leadership opportunity. I have the tour for diversity in medicine that allows me to still focus on students and share all of this. But for me, family medicine and my ability to help the larger community is this was the only path for me. There was never a question. So with that, we have come to a full hour. I never get to talk about myself. That was kind of fun. We have we have come through a full hour. Do you have any final thoughts? I think we got a bunch of questions and comments. Oh no, you guys are saying goodbye and everything. I appreciate that. We can definitely drop emails and stuff if you guys want to stay in touch with us. Any final thoughts, points of advice, anything we didn't touch upon from any of our panelists before we close out?
I did want to address the one question in regards to, and I think Dr. Smyre and Dr. Lee about the other perspectives and the importance of like contraception and things. But just in approaching that with programs, I think is really, in addition to those thoughts about how you plan to still support patients, even if you don't plan on providing those services. And there are ways to do that. So in my cohort, there was actually a resident that felt very similar, where they weren't going to prescribe any form of contraception from a birth control standpoint for religious reasons. And so it requires some planning. But they made it work, and they were very supportive of the patient, definitely getting the support that they needed, and being, you know, pliable to also work with that. So they just always made sure there was like a backup person when she was scheduled, you know, on outpatient and things like that. So
That's huge. You can balance your own, personal practice with the needs of your patient. It is possible. So I think that's a great point, Dr. Wall.
And I would say along those lines, it's important to do your research about programs, because I was that resident. I'm comfortable prescribing birth control, but I didn't want to do terminations. But I still did a rotation at Planned Parenthood. They were able to customize it, but my program was a ready program. But this was one of the things that I felt comfortable discussing during interview, and I was able to justify and state where I was coming from and my desire to ensure that my patients did have access to those services. But if you're looking into a program that has a strong curriculum in that area, and that may or may not be the best program for you, especially if they don't have a solid plan. They're all supposed to have a solid plan for providing you with opting out, but some programs, they either have not had residents to opt out, so they're in the process of developing that and would have to develop that while you're there. And so that may or may not be the best program for you. So those are things that you may want to inquire about during your interviews.
Thank you both. It's an important topic. Thank you guys. All right, with that, thank you students so much. Thank you to my friends, my colleagues, as always. I love seeing you. Please definitely everyone stay in touch. Follow us on social media, Tour for Diversity, we're everywhere. And thank you for joining us. Have a great night.